Healthcare communication. Communication is a combination of verbal and nonverbal behaviors, integrated for the purpose of sharing information. Health communication encompasses the study and use of communication strategies to inform and influence individual and community decisions that enhance health. It links the domains of communication and health and is increasingly recognized as a necessary element of efforts to improve personal and public health. Importance and relevancy of professional healthcare communication with other professionals. Lack of communication between colleagues contributes to a large number of unanticipated events in healthcare. It has been shown that lack of communication amongst coworkers leads to poor teamwork. Poor teamwork is the cause of avoidable quality of care problems and malpractice claims. Importance and relevancy of professional healthcare communication with patients or clients. Effective communication allows patients to give accurate information on the symptoms and problems that they are having, which allows healthcare providers to give the correct diagnosis. Effective communication allows the patient or client to build a therapeutic, trusting relationship with the healthcare team. When there is effective communication amongst patient or client and healthcare professionals, the patient is more apt to be compliant with treatment.
Okay, what's going on today? What are you here for today?
Well, I got a lump on my neck right here. I've had it for about 2 weeks.
Yeah, I don't need to see that.
Scratch it? Is it
Ricochet.
But I'm really concerned about it, nurse. I mean, it's, I
Yeah.
had,
See it? It's right over
Now,
there.
you
It's
want to
right
be the nurse?
but it's really bothering me. I haven't been able to
Look,
sleep.
I know. Good. Look, sweetie, just take it easy. Look, the doctor's going to be in a second. Take a look at that, all right? So,
So you're not going to do anything about it, or?
Hey,
here's
how's it
Dr.
going?
Gans. Dr. Gans.
Dr. Gans, how's it going?
Hi, nice to meet you.
What's going on? What brings you in?
Well, I've got a lump on my neck, and I've had it for.
Oh yeah, you know what? I think that is going to be a lipoma. No problem. What we're going to do, little operation, cut it right out. Use a little anesthetic. No, minimal risk. Do it all the time. Of course, you always have to worry about death, but hey, who doesn't have to worry about death
Dr.
nowadays?
Gans.
Death?
Ira Gans.
Gotta
Dr.
go
Ira
on.
Gans.
What is
Talk to
it,
you.
Dr. Gans?
Gantz? What does it have?
Dr. Gantz.
All right.
What did he say?
Something about a tumor.
Did she say lymphoma?
It sounded like it was some kind of oma.
My grandmother died of lymphoma, remember?
Oh yeah, I remember that. Is that what it was?
It was.
Oh no.
You have cancer.
Oh no.
Is that
What are we gonna do?
Cancer?
Okay, did Dr. Gans tell you everything that's going on?
She came in and said I've got lymphoma.
Oh,
See
no. Here's a pamphlet. Look this over. And anything that's you don't understand is on here. Okay, but you're gonna have to sign a consent form. Hang on a second. This is a good song, isn't it? Yeah, baby. Oh, hold. I'll be back. I'll be back.
But nurse.
Hey, yeah, I'll be right down.
Nurse.
Nurse.
What is this for?
Hi, Mr. and Mrs. Smith. I'm Nurse B. Good.
Hey,
How are
nurse.
you
How are you doing?
today? I hear that you have a consent for me to pick up. Are there any further questions that you might have?
What is this for? I don't even know what this is for. Nurse Roche just handed it to me and said I need to sign it, but I have no idea what it's for.
Well, I have your chart, and the doctor said that you had come in for a lipoma on your neck.
No, the doctor said I got lymphoma, is what she said.
Well, let me look here. Yeah, it says that you have a lipoma, which is just a fatty tumor under your skin. And so what we had set you up for was an excision of that or a removal of that. And what will happen is he'll come in and he'll give you a little numbing medication, some lidocaine under your skin, numb it up, make a small incision, remove that tumor, give you a few stitches, and then in about 7 to 10 days we'll come back and have you come in and we'll remove those sutures out. But it doesn't turn metastatic, it's not cancerous.
What does that mean? Metastatic.
Yeah, it's not cancerous.
It's not
so It's not
cancer.
cancer. You do not have cancer. You have a
Hear that,
fatty
honey? Oh,
tumor.
wow. We don't have cancer after all.
Yay.
Oh, great.
And I do have you scheduled for next Wednesday at 10 o'clock if you both will be available.
Sure, yeah.
Okay.
That sounds good.
And then if you have any further questions, I'm Miss Good, and if you want to call and ask, I'll be more than happy to speak with you.
All right, that's good. So I just need to sign this consent form.
Yes, sir.
Okay.
And then I'll
All right.
take that from you.
Okay.
Do you have any allergies?
I don't want to see no song. I don't want to see no song. I don't want to see no song.
Role of effective professional healthcare communication on health. Patients' perception of the quality of healthcare they received are highly dependent on the quality of their interactions with their healthcare clinician and team. There is a wealth of research data that supports the benefits of effective communication and health outcomes for patients and healthcare teams. The connection that a patient feels with his or her clinician and healthcare team can ultimately improve their health, mediated through participation in their care, adherence to treatment, and patient self-management. Patient satisfaction increased when members of the healthcare team took the problem seriously, explained information clearly, and tried to understand the patient's experience, and provided viable options. Theories and principles of therapeutic communication. The primary goal of therapeutic communication is to make the patient feel and realize that he or she is being taken care of, and the pain, agony, or feelings of the patient are well understood and adequately addressed through treatment, care, and assistance. One of the most important aspects of therapeutic communication on behalf of the nurse is to be non-judgmental. In other words, the nurse should accept what the patient says as it is without passing any personal judgment. The nurse should be aware of his or her own biases and should not allow his or her biased vision to intervene with what the patient has to say. The nurse can extend best possible care and assistance only when he or she accepts the patient's remarks and understands what the patient says, keeping his or her judgment or bias under control. The nurse should be an active listener in therapeutic communication. In other words, he or she should correctly interpret and understand what the patient conveys during conversation. The nurse should ensure this by repeating what the patient has said and providing an opportunity to the patient to confirm what he or she had said about the problems. This is a hallmark of active listening, and every nurse should be an active listener. Effects of ineffective communication. Ineffective communication is the number one reason for medical errors. Many times these errors occur because of lack of communication between healthcare staff and because of poor documentation. Ineffective communication among patients, staff, and physicians can prevent scheduling conflicts or overbooking, which is the biggest reason for long wait times. Lack of communication and avoidance many times leads to conflicts amongst coworkers because it builds resentment. Effective communication allows conflicts and misunderstandings to be worked out and problems to be resolved. Bad decisions usually arise from lack of information. It is important that all staff members speak up about concerns by providing feedback in a positive and productive way, which can help make decisions that provide best outcomes for the staff and patients. Lack of communication can increase stress due to unnecessary worry and concerns over workplace issues. It is important that nurses communicate with all coworkers and not be afraid to delegate tasks to avoid burnout and provide patient safety.